The step there is pretty important for people to be able to do as they get older.
Now, let's not forget Katie's one patient one time. One of her patients, she said, bought a two-story house to make sure she had to keep doing steps.
Going against convention. In the pro, what is the step test or the stair step test look like, Dan?
Stepping up onto a 20-inch surface. If you can do that, you can probably do anything throughout your day.
On 20, that's more of like a standard chair, right? When would we stop this test?
If they just appear really unbalanced, you'd be worried about them falling, trying it out, or if they have a lot of pain anywhere with trying it.
What are some common compensations that people might make that would indicate they have a weakness or a future inability, even if they can do it now, a future problem with this movement?
Caving in of the knee. If that really starts diving to your midline, then that's going to usually be a problem from the ankle, the knee, the hip. Something's got to give there.
What are other things that would motivate someone to be like, yeah, I should really focus in on my ability to do a higher step than just a standard step, because it's going to get me what as I age?
The higher that you can step up, like, your legs have to be pretty strong to do that. That's going to be very important for fall prevention. For if you do fall, you probably are less likely to have osteopenia, osteoporosis, sarcopenia. So like when we're talking bone or muscle loss, the chances of any of those things are much lower if you just maintain that strength.
So why do people lose the ability to do higher than standard step?
Because they don't do it. It really is that simple a lot of times.
As people get older, if they don't do this, what do you think, Dan, or other things that they're not going to be able to do?
Anytime they go out and have to go to any multi-story building, they're always going to try to take the elevator. And if that's not working that day, then they're kind of going to get forced into doing the steps. Hunting's a good example. If you want to kind of walk around, even like hiking, trying to get outside and do more active stuff like that, you're going to have to step up onto things at times.
What is some programming going to look like for someone who struggles to get up onto a 16-inch step?
So they'll probably still have some type of step up in their program. It might be just to a standard step and for more repetitions or holding some weight. Some way to start strengthening that. We'll have them do like sit to stands or squats, bridges, just a lot of things that are going to strengthen up the lower body.
What are the positive side effects of doing this as we get older?
It's just going to be like increased function overall, the ease at which you'll be able to do all your daily activities around the house or out in the community are going to be a lot better. You'll be less fatigued going up a flight of stairs, probably just have better energy levels throughout the day.
I would say that being able to do difficult things from a place where you're not even willing to do it would improve your confidence in your physical abilities, right? And it might seem kind of to someone who's, in their 30s and 40s, like how much confidence can that build? I would say you haven't worked a lot with people who are in their 60s and 70s, and seeing, one of my favorite things in the clinic is to have somebody straight bar deadlift that is in their 60s or 70s. Whenever I have the opportunity to take stairs or to take an elevator, I always take the stairs because one, it's just a reminder that I'm physically able to do it, which is nice. And two, it's an opportunity to introduce mobility and strength and balance into my routine.